Ladies and gentlemen, thank you for standing by and welcome to the LA County COVID-19 update. At this time, all participants are in a listen-only mode, and later we will conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during today's conference, please press star, then 0. An operator will assist you offline. I will now turn the call over to our host, Supervisor Catherine Barger. Please go ahead, ma'am.
Thank you. Good afternoon. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. Thank you for joining us today for the briefing. I hope everyone found some joy this weekend and discovered opportunities to connect with family and friends from afar. Many of your community members were celebrating Easter or Passover, and I know it was an incredible sacrifice to be separated from the loved ones. I do not take this lightly. Your decision to stay home and forego some of your favorite annual traditions, the big family dinners, church services, egg hunts, are something that we all look forward to each year. Though I'd like to offer some of you encouragement, from the bottom of my heart, thank you to our community for doing your part. These holidays remind us that after a long period of hardship, there is hope and peace waiting for us on the other side. May we hold true the promise that while we're facing the battles now, remember it is only temporary. There really is a light at the end of the tunnel. In our ongoing effort to combat this crisis, the Department of Public Health announced plans to extend the Safer at Home until May 15th. Over the weekend, the county announced 779 new cases of COVID-19. While the number of cases continues to increase, we are hopeful that our efforts through our health officer orders and distancing measures are working for your ultimate benefit. This decision will help us get to the end of this crisis more quickly. I assure you, the more we stay home now, the sooner we can get back to normal. Dr. Barbara Ferrer, our Director of Department of Public Health, is here to provide the daily update on COVID-19 in Los Angeles County. In addition, we will hear from our Interim Probation Chief, Ray Leva, regarding our Justice Partners' efforts to slow the spread of COVID-19. This includes making changes from our adult populations, identifying youth for early release from our juvenile halls and camps, and working with our public health officer to ensure safety for all of those still in our facilities. This is a very thoughtful process that requires an all-hands-on-deck approach to balance public health and public safety. I'd like to especially commend our probation staff for their efforts and extend my gratitude for their resilience. Much like our other county departments, our probation staff work on the front lines, serving the community through this crisis. We appreciate everything you do each and every day. And with that, I would now like to turn it over to Supervisor Hilda Solis, Pro Chair TEM for the County Board of Supervisors. Thank you.
Thank you, Chairwoman Catherine Barger, for your leadership. And I want to say good afternoon to everyone, and thank you all for joining this important briefing today. I'm Supervisor Hilda Solis, the Chair Pro Tem of the Los Angeles County Board of Supervisors, representing the 1st District. Each and every day, Los Angeles County releases the data the community needs. This includes the number of those test positive and those who have tragically passed away. This information is crucial to help our community form an effective defense against this virus. However, these staggering numbers of confirmed cases and deaths in Los Angeles County are not just statistics. These are real people struggling and often suffering through COVID-19. These are people who have died, people with loved ones and friends who spent Easter and Passover not with joy but in mourning. And I want to take a moment and recognize the tragic impact this virus has had on so many of us and throughout our communities. We mourn with you. In these difficult times, stress and anxiety are normal reactions. It's important to take care of yourself and recognize how you're feeling. Stay focused on your personal strengths. Maintain a routine that can help you feel more in control of your own well-being. If you feel overwhelmed with stress, please ask for help. During this time, teletherapy, support groups, and counselings are accessible through phones and the internet. Speaking to a therapist is one way to take care of your emotional health. Please reach out if you need assistance. Stay connected with friends, loved ones, and community groups. And if you need resources, support, and counseling referrals, please call 800-854-7771 or text LA to 741-741. County residents can also practice self-care on mobile devices. Suggested well-being apps can be found on our Department of Mental Health website. Just go to dmh.lacounty.gov. Also, I want to announce a resource our crisis response and essential workers in Los Angeles County can receive. The county is pleased to launch a hotline to assist these workers with connections to childcare so they can have safe and nurturing care for their children while they are serving on our front lines. Those in need of childcare can call the hotline at 888-922-4453. While residents are required to stay at home per the Safer at Home order, essential workers continue reporting to work. To support essential workers, a response team consisting of more than 4,000 child care slots across the county and an infrastructure for connecting families in need to child care has been established. In addition, LA County, with First 5 LA and the City of LA's Mayor's Fund, is also raising funds to subsidize care for emergency health care workers and who otherwise would not have child care. Many thanks to the partners who've been instrumental in this work: the Department of Public Health, the Child Care Alliance of Los Angeles, First 5 LA, the Los Angeles County Office of Education, and of course, our wonderful nonprofit partners. Aligned in this effort, on April the 10th, Governor Newsom released $100 million to support child care services for essential workers and vulnerable populations. I want to personally thank the governor for his leadership and the necessary investment to keep children healthy and safe while supporting our workforce. It makes sense. I'd also like to say a few words about young people in the juvenile justice system. Before the pandemic, the vast majority of these young people already endured too much trauma. And living through an event like this removed them from their families, and it only increases that trauma. For this reason, we must release young people who are close to their release dates and can be safely returned home or provided non-custody placements where they can receive support that they need. And I hope that the courts will join us and act with the needed urgency to support the release of as many young people as possible. Releasing young people from incarceration is the most effective way to reduce COVID-19, and it is the right thing to do. And I want to thank our community service providers that support those efforts. And that's why I authored a motion to be considered by the Board of Supervisors tomorrow to provide at least 90 youth in the probation system with the stipend from the AmeriCorps and the county to be trained and employed by community partners. Creating these workforce opportunities is essential during the COVID-19 pandemic. We have to make sure that our youth return home and that they succeed and can be placed back in their community. And that's why I'm so thankful that you're going to hear from Chief Ray Leyva, our interim probation officer, who is here today to also share very valuable information. And lastly, in regards to our hospitals, we continue to ramp up our surge capacity. St. Vincent Medical Center, in the heart of the 1st District, is essential to that goal. The hospital has a long history of serving LA County residents, and that role continues during the COVID-19 pandemic. We look forward to accepting patients at St. Vincent's Medical Center, the LA Surge Hospital, and soon we'll know about its opening later today. This is a critical response to the COVID-19 in partnership with Governor Gavin Newsom, Kaiser Permanente, Dignity Hospital, and the County of Los Angeles. With that, I am very pleased to introduce our Public Health Officer, Dr. Barbara Ferrer.
Good afternoon. Thank you so much, Supervisor Solis and Supervisor Barger. I know that we feel, all of us, really grateful to have your extraordinary leadership during these very difficult times. And I also want to thank everyone in our communities, particularly those who really made some changes to their faith traditions so that they could stay apart while they celebrated. I know this was a tough weekend for so many, but I'm so grateful that people are doing their part and really honoring the directives in the health officer order. I'm sad to report that there are an additional 25 deaths today. 11 people who passed away were over the age of 65, and they all had underlying health conditions. 12 people who passed away were between the ages of 41 and 65, and 11 of the people who were between the ages of 41 and 65 also had underlying health conditions. I don't have this information for the 2 cases that are being reported by the City of Long Beach. This does bring the total number of deaths to 320 in LA County, and our mortality rate for COVID-19 has jumped to 3.4%. For the deaths where race and ethnicity has been identified, 14% of the people who died were African American, 18% were Asian, 33% were Latinx, 33% are white, and 2% identified as with another race or ethnicity. And I know that so many of you are experiencing the profound loss, and you're mourning family members and friends who died with complications associated with COVID-19. You're in our thoughts and our prayers every day, and we wish you healing and peace. Today, we're also reporting 239 cases, and although new cases historically on Monday can be lower because of the limited testing over the weekends, I want to note that today's number of new cases is the lowest number of new cases we've reported since March 26th, and that's a good thing. There are a total of 9,420 cases in LA County. These cases include 337 cases reported by our partners in the City of Long Beach and 117 cases reported by the City of Pasadena, both which have independent city health departments. We're confirming today 23 cases amongst people experiencing homelessness. This is a slight increase from Friday. The majority of all of the cases of people experiencing homelessness who are positive for COVID-19 continue to happen amongst people who are unsheltered. The 4 people who are experiencing homelessness who were sheltered are all appropriately now isolated, and their close contacts are quarantined. 2,354 people have been hospitalized at some point while positive for COVID-19, and this remains about 25% of all of our positive cases. There are currently 1,059 people positive for COVID-19 that are hospitalized, and 18% of these people are in the ICU, and 15% of all the people hospitalized are on ventilators. You can see an updated report on LA County cases on the Department of Health's Public Health's website at publichealth.lacounty.gov. And I want to note that our rate of hospitalizations and utilization rates for both ICU beds and for ventilators has remained also relatively steady over the past week. And I'm grateful to all of the healthcare workers who have responded to make sure that people are, in fact, able to get care and recovering. We are currently investigating 185 institutional settings with at least 1 confirmed case of COVID-19. This is 8 additional investigations since yesterday. This includes investigations that are happening in nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in institutional settings is 1,372. 681 of the people who are confirmed as positive are residents in the settings, and 691 are staff and employees. And I'm sad to report that 92 residents who have died from COVID-19 were residing in institutional settings, primarily at skilled nursing and assisted living facilities. And this represents 29% of our deaths. And I want to thank everybody who's working so hard in all of our nursing homes and our congregate living facilities to provide care We're with you in the need to make sure that employees at all of these settings have the personal protection equipment that is desperately needed in order for them to remain of service to some of our most vulnerable residents. We're also reporting 89 confirmed cases in jail facilities. This includes 26 inmates and 63 staff. There are 28 cases reported in our state prisons in LA County. That's 18 inmates and 10 staff. And there are 4 cases reported from our juvenile facilities, and these were all among staff. We're also reporting 14 cases at a Department of Children and Family Services facility, and this is 1 young person and 13 staff. We post a list of facilities with confirmed cases on our website once families, residents, and staff have all been notified. And I want to note that with the spread of COVID-19 in our communities, we continue to see more and more cases among staff and residents at institutional settings. And I know this is a challenging time to try to figure out how to best meet the needs that often require that people remain in institutional settings while making sure that we have every protection possible, both for residents and staff. And I hope you know that we have DPH teams that work with every single facility that has a positive case so that management and staff, along with county support, can do their very best to protect the health of people who are residing in our facilities. The Los Angeles County Sheriff's Department is reporting 33 positive cases among staff today. They have 429 staff that are quarantined or have been quarantined, and 230 staff that have already returned to work. The LA County Fire Department is reporting 16 positive cases among staff. There are 19 people quarantined in their homes, 3 who are isolated in their homes because they're ill, and 13 who have already returned to work. And I want to again thank Sheriff Villanueva and Chief Osby for tracking and reporting this data. Almost 52,000 people have been tested in LA County to date, and we have reported results for, and the positivity rate amongst those tested is at 13%. We have almost all of the backlog of negative cases entered into our electronic lab record reporting system. And so I think we're only missing about another 2,200 negative cases that we'll be adding in over this week. And testing capacity has increased, but because it's still limited and because there are still significant time lags in getting results, testing is still recommended only for those people who are symptomatic. And I'm grateful for all of the work that Dr. Kazan has done to open up testing capacity along with the work that's being done at the city. And we're looking forward to making sure that we address issues of barriers to testing in some of our communities where people have less resources. So hopefully over the next few weeks, everybody who needs to get tested because their provider has asked that they be tested is going to be able to get tested, and we're going to be able to get those results in a timely way. Today I wanted to also provide you with an update on cases amongst healthcare workers. First, I want to start by thanking every single person that works in our healthcare facilities, from the receptionists and the cleaning crews to the nurses and the physicians. Your jobs are especially challenging during the pandemic, and we're grateful for your dedication and your ability to come to work every single day so that we can all receive the care that we need when we seek medical services. I am sad to report that over the last month, we have lost 3 people who have died who worked in healthcare settings. 2 people worked in hospitals, and 1 person worked for correctional health. And again, our prayers are with families and friends of these brave individuals who really lost their lives while providing a service to all of us. At the end of last week, there were 787 confirmed cases of COVID-19 among healthcare workers. Nurses account for nearly 1/3 of all the cases, and physicians account for another 9% of cases. However, there are many different types of healthcare workers who are known to be among those with a positive COVID-19 diagnosis. This includes EMTs, receptionists, lab workers, as well as workers from all of the other healthcare occupations. The majority of healthcare workers, about 60%, did not know or report on their source of exposure. Those who did know their source of exposure, 24% were exposed to COVID-19 through contact with a patient or another healthcare worker. And again, I want to note that we continue to track what's happening in our healthcare facilities so that we can make sure that our workers are protected to the greatest ability possible. The cases among healthcare workers are from 22 different clinical settings across the county, but 43% of them worked in hospitals, 19% worked in skilled nursing or assisted living facilities, and 12% worked in outpatient settings. We support all the work that's being done to make sure that every healthcare worker has the personal protective equipment that's needed. And we know that the best way to help healthcare workers is to make sure that they are safe as possible when they go to work every day to save lives. The word grateful does not begin to describe how we feel about our healthcare workers. Their heroism and sacrifice cannot be understated, and we thank them very much. I wanted to close by spending a little bit of time talking about what it means to self-isolate and to self-quarantine. And as the virus spreads, more and more of us will need to take these steps. It's really important that people understand that the heart and soul of us being able to contain the virus over the many months of a pandemic is in the ability for people to know when they have to self-isolate and when they have to quarantine. So let me just issue the reminder. If you've tested positive for COVID-19, if you have symptoms of COVID-19, if you have symptoms and you're waiting for your test results, or you've been told by a provider that you're likely to be positive for COVID-19, you must self-isolate immediately for 7 days and 72 hours after your fever and your symptoms subside. And let me just walk through what it means to self-isolate. It means that you're going to need to stay home at all times except for a medical appointment. And when you're home, we ask that you stay in a specific room that's just for you, away from other people in your home as much as possible. If that's not possible, please use a cloth drape or some other physical barrier to create a space that allows you to be separate from other people in your home. And make sure that you are always keeping a 6-foot barrier from everyone else in your house. And if you have to be around anybody else or you're leaving for a medical appointment, you must wear a clean cloth face covering. Don't allow any visitors into any part of your home. Don't handle pets. Don't provide child care, and don't care for other people, other members of a household. If you can, and it's possible, use a separate bathroom from everyone else in your home. And if that's not possible, the bathroom needs to be cleaned after every time you use the bathroom. And you need to be sure that any common surfaces or objects that you must touch, like in a kitchen, are cleaned and disinfected after you use them. Don't prepare or serve food to anyone else in your home. And most importantly, we're asking you to please tell all your close contacts that you had for 48 hours before you had any symptoms, before you self-isolated, before you got sick, that you have COVID-19 or are presumed to have the virus, and that they will need to quarantine themselves. Staying away from everyone, keeping objects and surfaces you use clean and disinfected, and notifying close contacts are very important steps that we ask everyone to take who must self-isolate. And if you've been a close contact of someone who's positive or presumed to be positive for COVID-19, please self-quarantine, and this is unfortunately for 14 days from the last time you were with that person. And self-quarantining is similar to self-isolating. It means you need to stay home at all times except for medical appointments. No shopping, no visiting other people in your home or in other homes, no going out at all. You're quarantining and staying home and away from everyone else. And it is hard to stay away from other people who live in your household, but we ask that you do your very best. And if possible, you too should be quarantining in a separate room and using a separate bathroom. You too need to stay away from children, from pets, and from other people that you might have been a caregiver for in your house. You too need to not prepare food or serve food while you're quarantining. And this is hard because, in general, people who are quarantining feel well. They're not sick, they may not be symptomatic, but you're going to need to remain in quarantine for the full 14 days to make sure that you too don't start to develop symptoms and infect others with COVID-19. So people who are self-isolating and self-quarantine should not be going out to get food, medicine, and other essentials. So for all of us, it's a good idea to prepare now in case you're going to need to self-isolate or quarantine. And this means stocking up on supplies for a 2-week period and figuring out how you may need to get some supplies delivered. If you're tested positive for COVID-19, I also want to make sure people understand that the Department of Public Health will have someone that reaches out to you on the phone. So please take our call because we're able to provide you with essential information about how to be safe. And we will call everybody who we get a confirmed laboratory test from. There's also detailed guidance on self-isolation and self-quarantine on the LA County Department of Public Health website. That's publichealth.lacounty.gov. I know that LA County's already proven that we're able to work together, and we're taking the measures we need to slow the spread of COVID-19, and I'm really thankful for this. By engaging in all these measures, following the health officer orders, staying home, physically distancing, wearing cloth face coverings, self-isolating, and self-quarantining, we're protecting ourselves and we're protecting our family, friends, neighbors, and communities. We're extraordinarily grateful to be part of this wonderful community. And now it's my pleasure to introduce Chief Ray Leyva from the Department of Probation.
Thank you, Dr. Ferrer. Thank you, supervisors, for your kind introductions. As the doctors have stated, my name is Ray Leyva. I'm acting as the Chief Probation Officer for the County of Los Angeles during this time period. And talk about a challenging assignment walking in the door. But it's been exciting, and I'm so proud of the members of the probation department and the passion that they bring to the job on a daily basis when they're working caring for the youth and the adults in our population. For those of you who are not familiar with the work that the LA County Probation Department does, we supervise over 37,000 adults on a daily basis and 58 youth in the community, and also operate 2 juvenile halls and 6 juvenile camps and treatment facilities. Probation is dedicated to the safety of everyone who lives in, works in, and visits our juvenile facilities and area offices. We are following the guidelines of the Department of Public Health and Health Services to limit or prevent the spread of COVID-19 among staff and youth. Currently, and I'm proud to say, there are no youth who have tested positive for COVID-19 or are pending results. Any youth that did have any of a slight indicator, I think we had several youth that had a fever. We tested for COVID-19, and they have all come back negative. Probation staff, on the other hand, I have to sadly report that we have 16 probation staff that have tested positive. 6 of those staff have worked in the juvenile facilities, and 9 are working outside of the juvenile facilities. But they are all doing well. I want to thank the probation employees who are showing up to work to do essential functions, including those who are working at our juvenile facilities to provide care for the youth in our charge. Our staff work side by side with medical professionals from Juvenile Court Health Services and the Department of Mental Health, who are constantly monitoring the health and well-being of our youth. We have instituted several precautions to keep the youth safe and our staff safe, including, but not limited to, keeping the youth congregation down to 6 or less when possible, having youth shower individually instead of group showers. And during mealtime, we encourage youth to sit at separate tables and in small groups, less than 4, if at all possible, to maintain that social distancing. And in the event that we do have a child or youth that tests positive, we are looking at locations within probation where we can isolate and quarantine that youth. Fortunately, we have not had to do that, and we look forward to being able to maintain that zero level. Visitation at the halls and residential treatment facilities remains suspended, and to cope with that and the isolation that youth feel, we are looking at extending our phone privileges to the youth and providing additional services through either video conferencing or extended phone times. We are working with our justice partners constantly to evaluate youth in our care to try to reduce the number of population in our halls and camps. And to that end, I'm happy to say that within the last 5 weeks, we have reduced our population by over 30% in the halls and the camps, which is a tremendous achievement on our part, given the restrictions that we work under. Probation, unlike the jails and the sheriff, does not have the authority to release youth on its own. We have to work with our partners and the judiciary to give us the okay and the authority to release them. In wrapping it up, I have to close by saying that the responsibility to ensure community safety lies heavily with us, and to protect the public safety in our communities and within our facilities during this declared state of emergency. Probation staff stands ready to fulfill our duties to the juvenile and the adult population that we serve. Wanda, we are now ready to take questions.
Ladies and gentlemen, if you'd like to ask a question, please press 1 then 0 at this time. If you're using a speakerphone, we ask that you please pick up the handset before pressing the numbers. Once again, if you have a question, please press 1 followed by 0 at this time.
First question.
And our first question will come from the line of Patrick Healy with NBC4. Your line is open.
Hey, Patrick.
Patrick Healy, your line is open.
We'll go on to the next question and hold it. Patrick gets on, we'll have him come back.
Certainly. Next, we'll go to the line of Melanie Mason with Los Angeles Times. Your line is open.
Hi, this is a question for Dr. Ferrer. This is with regards to the modeling that LA County put out on Friday. We've heard from a lot of people who want to know a little bit more about what the model shows in terms of how many new cases are being predicted at the peak, the projection for the total number of deaths, and when the projection shows the curve going down to perhaps a handful of cases per day. Is that information that you'll be releasing, and what would the time frame for that information be?
Sure. This is Barbara. So I'm asking Dr. Galley, who's here with us, to come up and talk a little bit more about the modeling. I do think, as we noted from the very beginning, it's a model and it gives us some good information, but it's not necessarily going to be able to tell us exactly where we're going to be for either the peak or what that case count is going to look like at the peak. So we're going to continue to rely on the information that we gather every day to help us really take a look at exactly what's happening. And again, although we reported a relatively low number of new cases today, I want to be only cautiously optimistic, because always on Mondays we have a lag because of the lab reporting issues and the lack of testing that happens over the weekend. So, but I'm going to ask Dr. Galley to join us up here.
Hi, I'm Dr. Christina Galley from the Department of Health Services. Thanks for the question. I agree with the points that Dr. Ferrer raised. The model looks at projecting out the number of cases and contingent upon that, the number of hospital beds, ICU beds, and ventilators that are anticipated to be needed if social distancing is maintained over the coming few weeks. And what you'll notice on those curves for the slides that are posted on the county and the DHS website is that that curve continues to rise continuously at a slow rate. So because of that, you can't see the peak in cases in the time period along which the model plays out. What will indicate a peak is really in retrospect when we see those numbers coming down. And I think really for these purposes in that sense, talking about the peak isn't the most helpful way to think about this. A peak is something that we see in infectious diseases when we have the ability really to get to herd immunity through vaccination, or where you're anticipating that there's a large number of the population that will no longer be susceptible. And once you hit that benchmark, whether it's 60% herd immunity or whatever number people are using, you start to anticipate that you've hit your peak and then the numbers go down. Because we're taking a different approach with COVID-19, there's not the ability to get to that 60% herd immunity or higher levels of herd immunity because the lack of a vaccination. We're using the approach around public health interventions, infection control interventions like hand washing and masking, and physical distancing measures like being safer at home and quarantine and isolation. And because of that, the model does project us a rise, but a slower rise, one that can be accommodated within the existing capacity of the healthcare system, rather than building toward a peak. So we'll continue to update that model over time with the new data, make sure that it's continuously updated, and we'll make those slides available. But hopefully that makes sense as to why I don't think the peak is either possible to predict at this point or the most useful way to look at it. Next question.
Next, we'll go to the line of Celeste Freeman. Your line is open.
Hi, this question is for Chief Leyva. It's my understanding that you've submitted over 50 cases to have kids released from camps. Are you still submitting cases for the halls? And if so, about how many? And secondly, I see everything's being set up. Secondly, how much luck are you having in getting those kids released?
We had commented that we had submitted 50 cases to the judiciary for their consideration. We actually submitted slightly more than that, and they took it upon themselves to look beyond our recommendation. And last week, week and a half, they had actually released 66 juveniles from our care. And we continue to submit cases, working in partnership with the alternate public defender, as we evaluate the different cases that they bring to us, along with those that we search out on our own, to the courts. And again, as I said before, it is up to the judiciary to make that recommendation or to give that order to be released. But we believe that we are being very successful up to this point. Next question.
Next, we'll go to the line of Patrick Healy with NBC4. Your line is open.
Well, thank you for your patience. I hope you can hear me now okay. Peak is not a good word to use. Is it fair to say we have reached a plateau where the increase of the number of new cases has decreased? And secondarily, why do we think the mortality rate keeps going up even though we're catching up on that backlog of negatives? Thank you.
Yeah, thanks. So let me talk about the mortality rate going up. I mean, one issue that we should all just pay attention to is that oftentimes people who pass away or who die can be sick for quite a long while before they actually die. So if you look at what's happening in New York City, for example, you'll see that their mortality rates are going up while their case counts are going down. It's because people are sick and they've been sick for a while, and they may still pass away and not fully recover. So we are going to have a little bit of lag in terms of what mortality is doing, what deaths are doing, when compared to what cases are doing. And I do want to just be cautious about whether we've reached a plateau. We are, again, last week's numbers stayed pretty steady. The weekend always seems to drop, and again, I think it's because of the lag time on the labs and the lack of having the same amount of lab testing over the weekend. This will be a critical week again to see whether we maintain sort of a steady number. But I do want to note that we're only testing about 5,000 or 6,000 people a day, and that the positivity rate on the tests has really hovered somewhere between 10 and 15% the entire time, which means that if we double the number of people that are going to be tested and that positivity rate still stays fairly constant, we will see more cases at that point. We've always been honest about noting that we unfortunately are limited in really understanding exactly who's infected at any given point in time because of the limitations on testing. We learn more every day from the science. One thing we know is that there are some people who are asymptomatic and could in fact be infectious. And the other is that we know there's a fair amount of mild illness and people aren't getting tested necessarily with mild illness. So I've always said, for the last 3 weeks, we have to go through our days every day imagining that either we could infect somebody else or somebody else could infect us. Because in the absence of having as much testing as we would all like, and with the knowledge that asymptomatic people may be able to transmit, we don't know exactly who's positive at any given moment in time. We certainly don't know with enough certainty to have that be, the way we sort of protect ourselves. So it's why isolation quarantine really appropriate when you know you've had an exposure. And for all the rest of us, we have to just go through the world taking universal precautions at this point against any respiratory illness. But thanks for your question.
Next question.
Next, we'll go to the line of Matt Hamilton with LA Times. Your line is open.
Hi, thank you for being available for this. My question is for Dr. Ferrer, and it's why is your agency not providing more detailed numbers about the outbreaks at institutional settings, given that they're now nearly 30% of the deaths? I mean, do you not have detailed numbers about number of residents tested and number of staff members tested, or are you just unwilling to provide it to the public?
Oh no, I mean we're not unwilling to provide it, and I'll explain what the dilemma is. In many of the facilities, once there's a couple of people that have tested positive for COVID-19, then other residents who have respiratory illness symptoms don't necessarily all get tested. We just assume that they're positive and they receive that treatment as if they were positive. In other words, they're isolated at the facilities. Should they get sicker, should they have more serious illness, they will then be taken to the hospital where they will, in all likelihood, be tested. But so it's a little misleading what we track, because we would have sort of what we call a lot of presumptive COVID-19 patients that may be residing in a facility, but we actually don't have everyone that's been tested. But I appreciate the question and the concern, and we've tried to note now on the sheets that are in fact posted every day where we consider there's an outbreak because there's 3 or more people that residents that are either positive, or there's 1 resident that's positive and 2 presumed to be positive residents. But we could look at, if you're feeling like, we're trying to not give you good information. I never want you to feel that way. So let me talk to my staff about maybe creating a table that acknowledges the presumptive folks as well as those who have had the positive tests. Because, we want people to have the kind of information that helps them make sense of what's going on. So thanks for raising that. Next question.
Next, we'll go to the line of Claudio Pafuta with KNX News. Your line is open.
Hey, following up on Matt's question, if you guys could list the number of deaths at particular institutions, that would be helpful as well. And just want to find out if there are any outbreaks among homeless people. Barbara, do you think we'll get to the point where people without symptoms are tested in order to identify silent spreaders? And then going back to the question about a peak, I mean, we do have state officials talking about a peak in mid-May. I think it was the University of Washington analysis saying a peak for California on Wednesday. So, do you think that other officials should stop talking about a peak, given that you're saying it's not really helpful to look at things that way? Thank you.
Okay, so let me start with the questions about people in institutional settings. Yes, I always try to capture the number of people who died in institutional settings, and we're looking now at whether or not we can assign them to a particular setting. I want to again say one of the reasons why it's been complicated to post this is many times residents are not dying in the nursing facility where they got ill, and they're actually dying at a hospital, and then we have to actually go through their medical records to figure out which nursing facility they might have been in, and it takes us a little bit of time to just make sure we're doing that appropriately. Again, it's not meant to not give good information. It's just sometimes there's a little bit of a lag before we actually can tie all that back, because many people are in fact dying in the hospital, and they're not necessarily dying at one of our nursing homes or congregate living institutions, assisted living. Another question that you asked was related to outbreak amongst homeless people. We have a significant number of cases. We don't have any signs of an outbreak. We have quarantined folks at a couple of the interim housing facilities, a couple of the shelters. To date, we don't have any signs of an outbreak at either of those shelters. But I also want to note, again, that we haven't had the capacity to test everyone who's a person experiencing homelessness who might be particularly unsheltered and symptomatic and just not having good access to testing. So I would say, although we have no evidence of an outbreak, I would say it may be, again, a problem with the fact that we haven't done enough testing. So I don't want to really say I know for sure there are no outbreaks, because I don't think that would be accurate. And then in terms of the modeling, I think it's fine that people talk about the usefulness of the models in different ways. It doesn't really, I don't think it's really a cause for concern, and I think that's what Dr. Galley was saying. It's like, we all look at different pieces of the models to help guide decision making, and what's most useful for us is actually looking at the rates right now of people using hospitals and what kinds of services they're needing in hospitals, and trying to increase our capacity around testing so that we better understand what does it look like across our communities in terms of infection rates. But I don't think it's harmful to actually think about the fact that at some point you're going to start a downward trend in reporting on both cases, new cases, and reporting on the number of deaths, and that we're all looking forward to those days. But I think in terms of planning, it's probably most helpful to look at all of the data we check in on a regular basis to really figure out what we need to do next. So thank you. And next question?
I think this is going to be our last question, so one more question, please.
Next, we'll go to the line of David Rosenfeld with LA Daily News. Your line is open.
Hi, thank you very much. I wonder if you can comment on a situation at hospitals. We're hearing from a lot of administrators that their occupancy is down quite a bit, in some cases up to 40%. And I'm wondering, how does that jibe with the numbers that we're hearing from you all, that there are only about 1,500 hospital beds available countywide? That's the first question. The second question is, with conflicting messages that might be coming from the federal government in a month, with the president saying he wants to open the country by May, how do you expect that to play out with your own decisions locally? Thank you.
Hi, I'll take the first question, which was with respect to the low occupancy rate in hospitals. And you're absolutely right. Both for the DHS hospitals, we're running at about 50 to 60% of our normal staffed occupancy. The same is true, I know, of a number of private hospitals across the region, though the exact percentage does vary by hospital. When we report out the numbers that we do daily and that are posted on the DHS website, it's based on both a sampling of the 70 beds with emergency departments that are 911 receiving centers. So there are 10 or so hospitals that have available bed capacity that don't operate emergency departments, and those are not in those numbers. So that's part of the difference. And then also hospitals are reporting their staffed occupancy. So what they're counting is if a patient came into their ED today and needed a bed, how many beds do they have that are staffed and ready to go? So what hospitals normally do, and this is just good operations, is as their occupancy declines, they will not intentionally staff certain beds, but as their occupancy goes back up, they can quickly ramp up again their staffing on those beds. So what you see as the available staffed beds is what I would consider to be a very lower bounds of the number of beds that are truly available in the region. Those bed counts then don't count, those numbers don't include the beds that can easily be staffed up. They don't include those other 10 hospitals, and they don't include the other surge capacity that has been put online, for example, at the LA Surge Hospital, the Mercy Ship, and other sites.
Yeah, no, and thanks for the second question. And, I want to acknowledge that, we work very closely with our partners at the federal level, particularly with CDC and HHS. NIH, and I think there's 100% agreement that the strategies about what happens locally really need to be determined by the conditions locally, and we have a lot of variation across the country. So I know the president's really anxious for us to reopen. We're really anxious for us to reopen. I think everyone knows that reopening is going to be staggered, and we're going to make sure that what we don't do is act with some haste that causes a significant increase in both the number of cases and just as importantly, in the number of deaths. So we'll be using the information we have locally. I think we all have the same intent here, which is, we want to get to the other side of this. We want to get to the other side of this without causing either a collapse of our healthcare system or unnecessary deaths and illness. And to do that, we have to look at the local conditions. So I think we're working towards the same goals, and we've had a wonderful partnership with all of the federal agencies that support the work that's happening here. And I know that that's going to continue. And thank you very much. That closes the English portion of the press briefing, and we'll now move to having remarks in Spanish.
Buenas tardes, soy la supervisora Hilda Solís de la Junta de Supervisores del Condado de Los Ángeles. Cada día el Condado de Los Ángeles comparte información que la comunidad necesita. Esto incluye los números de casos positivos de la virus y también de las personas que han fallecido. Esta información ayuda a nuestra comunidad a aprender cómo luchar contra este virus. Me da mucha tristeza por los seres queridos que han perdido y quiero tomar un momento para reconocer estas tragedias y el sufrimiento de nuestros residentes. Estos tiempos, usted sabe, son difíciles, están causando mucho estrés en todos y es importante que todos se cuiden. Tratan de mantener una rutina que puede ayudarlo a sentirse mejor y en control. Comuníquese con amigos, seres queridos y grupos en su comunidad por el internet o por teléfono. Si se siente muy estresado, pida ayuda. Hay grupos de apoyo por teléfono que les pueden ayudar también. Para más información, por favor, llame a 800-854-7771 o envíe en el texto con las letras LA al 741-741. También quiero anunciar que el condado está ayudando a los trabajadores esenciales con el cuidado de sus niños. Tenemos más de 4,000 espacios de cuidado de niños en todo el condado para las familias que necesitan este servicio. Lo que necesitan este servicio pueden llamar a la línea directa al 888-922-4453. Y en estos tiempos también sabemos que hay muchos jóvenes que todavía no están con sus familias. Me gustaría hablar de los jóvenes en el sistema de justicia juvenil, aquellos que están en los centros y campos juveniles del condado. Deberíamos de librar a los jóvenes que están cerca de sus fechas de salir para que vuelvan a sus hogares y con sus familias. Es importante que estos jóvenes estén con sus familias en este tiempo y no en el cárcel, durante estos tiempos muy difíciles. Espero que los cortes también nos apoyan en este esfuerzo. Finalmente, quiero decir que el Centro Médico St. Vincent, en el corazón del primer distrito, se va a usar para tratar casos de coronavirus. Esperamos aceptar pacientes en el Centro Médico de St. Vincent. Empezamos hoy en esta tarde. Esto se logró con el apoyo del gobernador Newsom, Kaiser Permanente y Dignity Health, y también con el esfuerzo del condado. Me da bastante gusto que también nos va a ayudar a las personas que necesitan esta atención con el coronavirus. Quiero decir muchas gracias a todos ustedes y ojalá que pasaron buen Pascual y que todos se mantienen en sus casas con seguridad y también ponen atención al orden, que se queden en las casas. Ahora me da bastante gusto a presentar la directora de Salud Pública, la doctora Barbara Ferrer.
Muchas gracias, Supervisora Solís y Supervisora Barger. Su liderazgo continúa siendo realmente extraordinario en este momento tan difícil. Y gracias a todos ustedes del Condado de Los Ángeles. Para actualizarlo sobre nuestros estadísticos hoy, estamos tristes de reportar 25 muertes adicionales. Las 11 de estas personas son mayores de 65 años y todos padecían de condiciones delicadas de salud. Los 12 personas tenían entre 41 y 65 años. Las 11 de estas personas tenían condiciones delicadas de salud. Esto eleva el número total de muertes a 320 en el condado de Los Ángeles. Y nuestra tasa de mortalidad para COVID-19 es de 3.4%. Muchas personas están experimentando una pérdida profunda. Han perdido familiares y amigos por COVID-19. Los mantenemos en nuestros pensamientos y oraciones todos los días y les damos nuestro más sentido pésame. Hoy también estamos reportando 239 casos nuevos. Estamos informando 23 casos confirmados entre personas sin hogar y la mayoría no tenían refugio. 4 personas que fueron refugiadas están apropiadamente asiladas y los contactos cercanos están en cuarentena. Los 2,354 casos han sido en algún momento hospitalizados, el 25% de todos los casos positivos. Puede ver el informe actualizado de los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud en publichealth.lacounty.gov. Actualmente estamos investigando 185 entornos institucionales con al menos un caso confirmado con COVID-19. Las 8 investigaciones adicionales desde ayer. Este incluye en hogares de ancianos, viviendas asistidas, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados en entornos institucionales es de 1,362. Esto incluye 681 casos confirmados que son por residentes y 691 son empleados. Nos entristece informar que 92 residentes han muerto por COVID-19 en estos entornos. Esto incluye instalaciones de enfermería especializada y viviendas asistidas. Estos representan el 29% de todas las muertes. Publicamos una lista de instalaciones con casos confirmados de nuestro sitio web una vez que hemos notificado a todo su personal, residentes y familias. Con la propagación de COVID-19 en todo el condado, seguimos viendo más casos entre el personal y los residentes en entornos institucionales. Nuestros equipos del DPH están trabajando actualmente con todas las instalaciones que tienen un caso positivo y la gerencia y el personal están haciendo todo lo que es posible para proteger la salud de los residentes. Casi 52,000 personas han sido evaluados y han reportado resultados en el condado de Los Ángeles y el 13% tuvieron pruebas positivas. Aunque la capacidad de la prueba continúa aumentando, en este momento todavía estamos recomendando la prueba sola para aquellos sintomáticos. El condado de Los Ángeles ya ha demostrado ser capaz de trabajar juntos y tomar las medidas necesarias para frenar la propagación de COVID-19 y estamos muy agradecidos por esto. Al tomar estas medidas, quedarse en la casa, distanciarse físicamente, usar máscaras, tela para la cara, autoaislamiento y cuarentena, nos estamos protegiendo a nosotros mismos y a nuestras familias, amigos, vecinos y comunidades. Muchas gracias a todos. Ahora estamos puestos de coger preguntas. We can take some questions now.
Next, we'll go to the line of Alejandra Ortiz with Telemundo 52. Your line is open.
Thank you. And Dr. Ferrer, and this question is for you. ¿Cuántos casos de falsos negativos se han presentado en el condado, si es que tienen esa información? Porque prueba 2 y hasta 3 veces hasta dar positivo. ¿Y qué le dicen a las personas que han dado negativo, pero que siguen presentando sí?
La mayoría de los casos de los exámenes de las pruebas son negativas, porque solamente tenemos 13% que son positivos, los demás son negativos. Generalmente la gente sí tiene síntomas, pero son de otros casos, no son del COVID-19. Pero lo que yo le digo a todo el mundo, si usted no te sientes bien, tienes síntomas de cualquier enfermedad, tienes que quedarse en la casa, sola o solo y tienes que cuidarse, que no sales de la casa, aunque tienes que ir solamente para ir al médico, porque si una persona no se siente bien, no debe estar en este tiempo como una pandemia afuera de la casa. Ese es el aviso que tenemos para la gente que entran, pero que sale la prueba negativa.
Y esa prueba puede fallar, porque hemos visto casos en que las personas se repiten la prueba y sale negativo y luego sale positivo.
Eso sí se puede pasar, pero eso no pasa mucho. Se puede pasar porque una persona puede entrar a sacar la prueba y después hace 2, 3, 4 días y entra de nuevo y sale positivo, pero eso puede ser que ahora tienes la infección y cuando entraste no lo tenías.
¿Ustedes confían 100% en el test o hay algún margen de error en ese examen? Es decir, si tienen algún porcentaje de la precisión o el accuracy of the test.
No. Siempre con estas pruebas hay unos que sí salen negativos y no son negativos y salen positivos y no son positivos, pero son bien pocos. Generalmente nosotros para este examen si sale negativo, generalmente es negativo. Pero si no te sientes mejor, todavía tienes síntomas, tienes que llamar al médico a preguntarle si debes sacar otra prueba o puedes, quizás el médico te tienes que ver, que tienes que entrar a la oficina para que ellos hacen un examen.
Perfecto, Dr. Ferrer.
Ok, no, muchas gracias. Yo creo que no hay ninguna más preguntas, so terminamos ahora y we'll go to the Armenian presentation now for the rest of this briefing. Thank you very much.
Բարի օր բոլորիդ, շնորհակալ եմ հայտնություն կուզեմ խնդրել մեր supervisor Barger-ին եւ Solis-ին եւ բոլոր մեր Los Angeles-ի ղեկավարությամբ դոկտոր Ferrer-ով։ Այժմ կուզեմ ներկայացնել մեր ներկա կարգավիճակը։ Այսօր ցավոք սրտով կհայտարարեմ, թե 25 նոր մահ ունենք, որոնց 11 հատը 65 տարեկանեն վեր են եւ իսկ հետևյալները հիվանդություններ ունեցած են։ 12 հատը մերյալներ են 41 տարեկան 65 տարեկան են եւ որոնց 11 հատը արդեն ուրիշ հիվանդություններ ունեցած են։ Իսկ մնացյալ 2 հատը ավելի դեղեցություններ ունենք, որ Long Beach Department-ն են։ Մինչև այսօր 320 մահ կա Los Angeles-ի շրջանի մեջ եւ մահացուներն ուրեմն 3.4% գլա։ Ասկերեն ուրեմն 14% սև է, 18% ասիացի է, 33% լատինո են եւ 33% ջերմակ, ուրեմն մենք ադունց մեջը կփաղանենք եւ 2% գսեն, որ ուրիշ ասկեր են։ Գուզենք հայտնել մեր խորին ցավակցությունները այդ բոլոր անձերուն, որ իրենց սիրելիները գործունեացած են։ Մեր բոլոր երբ կկործենք միշտ ցեզի կմտածենք եւ մեր աղոթներուն մեջնեք։ Այսօր գուզենք դեղագացնել, թե 239 նոր հիվանդներ ունենք։ Այս վերջին 48 ժամվա մեջ 562 նոր հիվանդներ ունեցած ենք, իսկ բոլորը Los Angeles շրջանի մեջը 9420 եղած է։ Long Beach-ի մեջ 337 եւ Pasadena-ի մեջ 117 հոգի։ 23 հատը հիվանդներն դուներ չունին կամ homeless են, մեծամասնությունը դուներ չունին եւ 4 հատը զատված են։ Այսինքն հիվանդանոցներու թիվերն են։ Ուրեմն մինչև այսօր 2354 հիվանդներ ունեցած ենք, որ հիվանդանոց մնացած են քոնեկանի օր, որը գլա 25% բոլոր ընդամենը այդ հիվանդներ են։ Հիմա 1059 անց հիվանդանոց են, որոնց 18% ICU մեջ են, որ ավելի մոդիկ գնային եւ 15% ուրեմն ventilator-ներու վրա են, ուրեմն սնչարության օքսիգեն օգնություն կուտան։ Եթե վերջին դեղեցությունները գուզեք գտնել, հաջիկ մեր վեբսայթին կացեք publichealth.lacounty.gov։ Ներկայիս ուրեմն 185 դեղեր կան, որ զանազան հասարակություններ եւ այսօր 8 հատ ավելի ունեցած ենք, որ հիվանդները, որ COVID-19-ով են, ինչպես մեր ձերանոցները կամ դուներ, որ գոքնեն մեր տարածքներուն, աբաստարանները, բուժման թեղերու գետրոնները եւ փանդեր։ Այս հասարակություններուն հիվանդներուն թիվն է 1372 անց, որ մեջ 681-ը ապրողներ են եւ 691-ը աշխատավորներ են։ Ցավոք սրտի այսօր 92 հիվանդներ կմահանան COVID-19-ին պատճառով եւ կգտնվին ձերանոցներու եւ դեղեր, որ ձերեր կապրին։ Եվ ասկա ընդամենը ուրեմն 29%-ն է մերյալներուն։ Փանդերու մեջ 89 հիվանդներ ունենք, 26 հատը փանդարգյալներ են, 63 հատը աշխատավորներ։ Կալիֆոռնիայի կառավարական փանդերու մեջ ունենք 28 հատ հիվանդ, 18 հատը փանդարգյալներ են եւ 10 աշխատավորներ։ Ինչպես նաև երիտասարդներու փանդեր որ կան, որ juvenile facilities գոչվի անգլերենով, ուրեմն 28 հատը հիվանդներ ունենք, 18 հատը փանդարգյալներ եւ 10 աշխատավորներ։ Եվ ապաստարաններու կամ shelter-ի մեջ ունենք 4 հիվանդներ, որոնց 4 հատը աշխատավորներ եղած էին։ Եվ Department of Child and Family Services, որ բզիկներու եւ ընտանիքներու service-ի մեջ 14 հոգի ունենք, եւ 1 բզիկ եւ ուրեմն եւ 13 աշխատավորներ, որ COVID-19-ով են։ Մենք կդեղեկացնենք այս բոլոր դեղերը մեր COVID-19-ի կոնեմիան even մետե մեկ անց եթե ունենա մեր website-ին վրա, բայց առաջ դեղեցություն կտանք մեր աշխատավորներուն, բնակիչներուն եւ ընտանիքներուն։ Գուզեմ հիշեցնել, թե COVID-ներու հիվանդները ավելի կբարձրանան եւ մեր շրջանի Los Angeles County-ի մեջ եւ աս հաստատություններու մեջ կբարձրանան գոր։ Մենք ներկայիս շատ աջակցություն ունենք մեր բոլոր աշխատավորներուն եւ պատասխանատուներուն եւ կբացատրենք ինչ պետք են եւ կզադենք այդ անձերուն, որ պետք է մեգուսանան։ Ուրեմն ոստիկանության բաժանմունքին մեջ in the Sheriff's Department, ուրեմն այսօր 33 հիվանդներ ունենք, adոնց մեջ են 429 դունն են եւ 230 հատ յետ վերաթարցած է կորձի։ Եվ LA County Fire Department հրսեջի բաժանմունքի մեջ 16 հիվանդներ ունենք, 19 դունն են, 3 հիվանդները դունն են եւ ուրեմն 19 ընդամենն են ներողություն, 3 հիվանդներ դունն են եւ 13 հատը կորձի են։ Շնորհակալ եմ Sheriff Villanueva-ի եւ Chief Osby, որովհետեւ իրենք մեզի այս թիվերը տված են։ Գրեթե 52,000 քննություններ եղած են Los Angeles-ի շրջանի մեջ եւ 13% թրական պատասխան ունին։ Մեր քննությունները կբազմանան, բայց թեր աշխատենք որբեսի մինչև հիմա ուրեմն գուզենք այդ անձերը, որ ախտանիշներ ունին ադոնք չկնելու։ Առողջապահության ոլորտի աշխատողները, որ healthcare workers գսեփին, այս համաճարակին ադենը, ուրեմն 787 անց ունենք, փուշքույրերը 1/3 հիվանդներն են, հետևալ բժիշկներուն, որ 9% են։ Դժբախտաբար 3 աշխատողներն մահացած են, 2 հատը հիվանդանոցի մեջ կաշխատեն եւ 1 անց ուրիշ փանդերու մեջ կաշխատեր։ Աշխատավորները 22 ուրիշ տեղեր կաշխատին, 43% հիվանդանոցներու մեջ կգործեն, 19 զանազան ուրիշ կորձերու կամ բժիշկներու կով կաշխատին։ Նորեն շնորհակալություն կուզենք խնդրել այդ բոլոր մեր առողջապահական կորձագիցներուն, դուք մեր հերոսներն եք եւ կուզենք քնահատել ձեր զոհությունը եւ աշխատանքը մեր խնամելու համար։ Եթե COVID-19-ով кейսեր ունենաք, ուրեմն եթե գամ քննություն եղակ եւ գփորձեք կորքիտնալ թե ինչ է պատասխանը, ուրեմն այս բաները պետք է նեք։ Թիվ 1 ամիջապես պետք է ձեր դունը մնաք, պետք չէ երթակ ուրիշներուն դեղեր կամ ուրիշները ձեր տան մեջ կան, ուրեմն միան եթե դուրս պիտի ելաք, եթե բժշկական appointment-ներ եթե ունեցաք, ձեր տանը մեջ պետք է զատ սենյակ ունենաք եւ զատ զուգարան։ Եթե զատ սենյակ չունիք, պետք է այդ սենյակին մեջը գոտորե drape մկորձածեք, ինչպես հիվանդանոցներուն մեջ են, որբեսի զատ կնակ մնալ ձեր ընտանեկան անդամներուն հետը, եւ ամեն անգամ որ զուգարան կորձածեք, պետք է մաքրեք ձեր ետևը։ Այդ կեց վերջը, ուրեմն Միշտ պետք է երբ որ դանը լակ, միշտ պետք է գդորետ թիմակները կործածեք եւ երբ որ խոհանոց կմտնեք, միշտ ադիգա լավ մակրեցեք եւ դուք եթե COVID, եթե suspect եք կամ գմտածեք որ ունիք եւ քնություն եղած եք կամ եք, բեք չէ ջաշմը եփել ծեր ընտանիքներուն եւ երեխաներուն եւ մեծերուն բեք չէ նայիկ ուրիշներ պետք է գիտնան եւ ամենակարևորը պետք է մտածեք որ 48 ժամ առաջ ինչպես որ ծեր ախտանիշները որ ունեցած եք պետք է մտածեք որ ուրդեղ եկած եք եւ ուրդեղ եղած եք եւ որուն հետ շփում ունեցած եք այդ բոլոր անձերուն պետք է հեռացայնեցեք եւ ասեք որ հիմա դուք COVID-19 ունի կամ ստուկման մեջ եք որբեսի իրենքա գիտնան եւ իրենքալ պետք է ինքնարան ուրեմն առանցին պետք է լան quarantine, self-quarantine, որ ինքնա կարան դինացում որ գոչվի հայերենով։ Ուրեմն նորեն իրենքալ եթե քիծակ որ դուք կոնտակտ եք 14 օր պետք է դանը մնաք զադ նույնպես ինչպես ուրիշ COVID case-երուն պետք է զադ սենյակ ունենաք զադ պետք է արան զուգարան կորձածեք ուրիշները դուներ մի երթակ ուրիշները ծեր դան մեջ չեն գնարկալ եւ եթե եւ ադիգա COVID case-երնա եթե դանի գենթանիներ ունենեք հաջիկ մի ջաշմիդակ եւ մի թփչեք եւ նորեն ուրիշներուն ջաշմի արնեք ուրեմն այս բոլորը պետք է գիտնաք որբեսի ջաշ չի կորձածեք կամ ջաշ չի շինեք ուրիշներուն եւ թեղնորայքներ եւ ուրիշ բաներ որ պետք է հաջիկ հերացայներեք որ ուրիշները ցես փերեն եւ ադոր համար ավելի լավ է երբ որ հիմա գտնե գրնակ ասպոլորը պատրաստել որբեսի եթե աջամուն եթե ադան գլա բեկչունիկ մտածելու այդ մասին հաջիկ կացեք publichealth.lacounty.gov շնորհակալ եմ նորեն բոլորիդ որ միասին գործեք եւ միասին երբ դունը գմնանք թիմակները գտնենք մեր վրան եւ դունը գմնանք երբ որ self isolation կամ self quarantine պետք է անենք so նորեն շնորհակալություն եւ այժմ գավարդենք մեր այսօրվա մամուլի համաժողովը and this concludes our press conference for today thank you